The Sigma year has been filled with a lot of activities ranging from the 11th public lecture to the health outreach, the Power the Girl initiative, the digital skill training, the cybersecurity training, and particularly the Sigma Sports Festival. However, being a social philanthropic organization, one of our major events is Sigma Charity, where we try to give back to charitable organizations. This program has been done in a lot of ways, ranging from donation to the University Health Services, Jaja, donation to Oluyole Chezaya homes, visits to correctional facilities. However, this Sigma year, we plan to go about it in a different way, which is direct impact to indigent individuals in the university. And during the preparation for the event, a lot of suggestions were given. However, after considerations and advice from loyal Sigmites and not Sigmites, this particular method of distributing correction glasses to indigents and visually challenged University of Ibadan students was concluded on.
Sigma Club was established in 1950 on ideals of diligence, integrity, and discipline. And these ideals have moved its members over the years to be renowned for their character and sense of responsibility. This drive has made Sigma Club to engage in philanthropic activities over the years as our contribution to society. One of these engagements is the Sigma Charity. Sigma Charity is an humanitarian expression of Sigma Club's drive to contribute to society. This has included donations to orphanages, correctional centers, and to the indigent members of the society. Though our immediate community is the University of Ibadan, our activities have extended beyond it, such as in 1985, when we notably donated to aid in the aftermath of the Cocoa House fire. This year, Sigma Charity is themed Lifespring. Inside the University of Ibadan, we have donated multiple times to Jaja Clinic, donating items like benches, fans, and other essential health materials.
On this edition of Sigma Charity, it is themed a Sigma Lifespring project, and this project, unlike the health outreaches, which does only medical tests, we decided to take a step further by intervening and providing solutions to the health care needs of a student of the University of Ibadan. And on this edition, we plan to give out free prescribed glasses, and to get this, we do our publicity to ensure that indigent students of the University of Ibadan who need eyeglasses apply, and after we are done with the application process, we would head to Jaja to tell them our plans, and we are hoping that they will be on board with it and collaborate with us to ensure that this project becomes a reality. And then afterwards, we will therefore ensure that we have a scheduled date of test so that it will work well with the beneficiaries, and then it will also work well with the optometrist at the University Health Services. Then after they've done their eye test and they've gotten the prescription, we will then support the initiative financially and ensure that the students get their prescribed glasses for free.
For the Sigma programs, the same procedures we render for other people, we're going to render it for the Sigma Club beneficiaries. When they come, we run all the basic eye tests, pick out their refractive or their eye challenges, and advise them properly. Those who need glasses, we will give them glasses. When I heard about it as the head of the optometrists, it gladdens my heart. I give kudos to Sigma Club. Thank you for remembering Jaja.
The fact that at least 20 students are going to get the help that they require, I think it's a good start. It aids everything that we're doing, the University Health Service, the University Management. So Sigma Club coming to ensure that at least 20 more people can see better. That's a plus. So it's an addition to the things that we're doing, and it's very welcome.
Hi, my name is Howard Dimalaji Okoro, a 200 level student of the Department of Soil Resources Management, Faculty of Agriculture. Yes, I've had my eyes checked before this program, and the process was not all that bad. It was okay. It was not what I expected, not in a negative way. Yeah, I thought it was going to be more stressful, but it was less. Yes, the UHS staffs and the Sigmites we accommodated.
I'm Joy Samuel by name. I'm from the Department of Library, Archival and Information Science, and 100-level students from the Faculty of Education. Before today, I've been having issues with my eyes, a lot of pains, especially when it was so close to my test and exams period, because I had to read with my phones basically, and it was a whole lot coping because my eyes hurt a lot once I read too much on my screen, and eventually, if I try to read with my book, the pain causing an headache won't allow me, so sometimes I'll just have to leave the book and probably listen to an audio if available. The part of the screening process that stood out for me was when I was tested with a tonometer, because it looked like a machine working on my eyes, and it was so effective. So if I'm given the recommended glasses, it will definitely help my academia and personal life so much, because I'll be able to read conveniently with my phone. When I was given the glasses for a test, I was able to look at the screen directly with no pain, and I wasn't feeling the light effects on my eyes so much. Then sun rays, I'll be able to cope with sun rays, because I experience blurriness whenever I stare too much at the screen.
Hi, my name is Daniela Obikule. I'm a fourth-year dental student of the University of Ibadan, Faculty of Dentistry. For a while now, I've noticed that I could not really see what my classmates could see when we had classes, and there was slides projected and things like that. And also I had this headache that was never ending, every day or very regularly. And I'm very happy that I've been able to at least find out that there's a reason why this had been happening, and go the further step to do the screening to get glasses to correct it. Honestly, it's been very organized. It's been really a breath of fresh air. I mean, we got accepted, we got added to a group chat, everything was organized. They told you the day you'd come, the time you'd come, they welcome you, and with lovely smiles anyway. So it was really nice. I really like the attitude of the Sigmites or the Sigma Club members that I've been interfacing with since I applied to get these classes. I see the things that Sigma Club does both in the University of Ibadan, outside in other communities, and it really touches the lives of people, and I think it's very nice. And I say, Sigma Club, well done, and keep doing what you're doing. You're very well appreciated. Please understand. Thank you.
Wow, my experience is very, how can I say, very fantastic. And I'm surprised to notice that at this time and age, some students are still living with a lot of eye defects without accessing healthcare. Because I know in our own part as University Health Services, we've done a lot of massive awareness about taking care of your health, your eyes, and other part of the organs. Eyes especially, we've done enough campaign, we've created enough awareness, we've educated patients who visited eye clinic.
The University of Ibadan Health Service has had relationship with the Sigma Club for as long as I have been here, to the best of my knowledge, because there are quite a number of things that bear Sigma Club on them. This particular initiative whereby the Sigma Club thought about giving glasses to deserving individuals in the community, especially among the student population, is quite a welcome one, because as it has been discovered, a number of people who knew that they had difficulty with reading, visual disadvantages of different types, refused to seek help because they knew that they may not be able to afford whatever financial implications were there. And so the intervention of Sigma Club, even if it's for a single individual, is quite welcome and highly rated.
I'm surprised, out of the 20 patients we've seen, almost all of them have serious or very significant eye problems. And each time I ask them, have you been to eye clinic before? They say no. I say, don't you know that I have eye problem? They say they know. but they don't, they've talked to their parents and their parents are yet to do something about it. So this idea of sponsoring free eye care and the free spectacle among 20 students is a welcome development, and I'm very sure some of them who benefited from the beneficiary will always speak good of Sigma Club. And I pledge that the Sigma Club should not stop from here. They should move from strength to strength. They should do more of it. Because I, as an eye optometrist, I'm surprised that at this age, somebody will be in 300 level, have short-sightedness, will not visit clinic for one day. Some of them have not even registered with Jaja. One of the reasons why they're not even assessing is that they've not registered with Jaja. And I asked them, why didn't you register for Jaja? Register at Jaja. They said, they will come. They can't give me any specific reason. So, but for these gestures, one of them, since it's free, and they are coming and not even forcing them to register, but 20 of them benefit, must have been speaking good of you, and it's a plus to Sigma Club. Thank you.
Hi everyone, my name is Soladapo Olalekan Olarinwaju. I'm in computer science from the Faculty of Computing. Okay, prior to this experience, I had my eye checked a while ago. It was just for normal eye checkup, and my experience was that my eyes was checked and I was recommended to get glasses then, but I could not get it because I was not prepared for that. I have a very good experience. I was attended to as soon as possible, and the eye check was very fast, and I got my recommendation very fast as well. It's a good initiative, the Sigma Lifespring initiative. It's actually giving eye care to people. I happen to be a beneficiary, and I would encourage them to do more and more again. Thank you, Sigma Club.
My name is Babalai Ibrahim Olayinka, 200 level student from the Department of Quantity Surveying, Faculty of Environmental Design and Management. My experience during the eye test and the diagnosis period till this moment, I had been earlier diagnosed of myopic astigmatism, where I had been tested at the eye center, probably given recommended a medicated gas, but couldn't get that one. So during the test, I got tested in a different methodology, different from the one I've been exposed to before. I had a series of eye tests. I was even prescribed some medication to use. So far the experience was worth the while, and it was actually a very much better experience now. And the glasses I'm putting on right now, I can notice a much significant difference compared to before.
My name is Bamdele Abdulrahman Academy. I'm Faculty of Pharmaceutical Science. I'm 200 level. So I would like to say thank you to the sponsor of the Lifespring, Sigma Club Lifespring, for this opportunity, because lately, for the past months, I've been having difficulties doing the exam. So with this opportunity, I'll be able to watch, I'll be able to view, able to have a clear vision during the day or during any activities.
I'm Ogumola Eniola. I'm a student of 100 level from the Department of Microbiology, Faculty of Science. So when I heard about the initiative, I just found it as an opportunity, because I actually use glasses, but my glasses got broken, and the only opportunity for me to get another one is to go home and maybe next year. So someone told me about the free eye test and the glasses, so I took the opportunity, and I'm very happy about it because I can see better now after wearing glasses, because my normal vision is very bad. Even the optometrist told me that, do I have a glasses because my vision is bad, so I can see everything very clear now, and everything is okay and brighter. Thank you, Sigma Club, for this opportunity.
So my name is Comfort Kayan God Gift, and I'm from Faculty of Law 300 level. I'd like to appreciate Sigma for this idea that they brought up for this project. It has been a very impactful one indeed. So personally for me, I'd say, before I got my, I've been using glasses before, but it got expired, so I was not able to renew it. So now renewing my glasses will actually allow me to read more, and let me say also work under the sun, because I'm not able to work under the sun effectively because I have to squint my eyes. So the availability of these glasses for me will allow me to read, work under the sun and other things. So thank you very much, Sigma. God bless you.
My name is Ajibe Mabele Sadishela from the Department of Chemistry, Faculty of Science, 100 level. So the staffs, they were accommodating, and The optician, when I met him, was welcoming and he listened very well.
Okay, the truth is, it's beautiful. I use glasses also. When you think that you can actually see, and then you really then get a pair of glasses, and then you can really truly see. And I think it's really beautiful that you guys have afforded people who had done investigations a while back but are unable to afford to get their glasses done. But you have provided hope for those who want to say, okay, you know you have a problem, but you can't solve it. We're here to bridge that gap. So it was really good to see them, and the fact that many of them are just going like, wow, you mean I can see this? You mean I can read this now? Things that most of us take for granted. So well done, Sigma. You guys have done well.
The most prevalent of all the eye problems is myopia. So for those that we've seen, most of them is almost 90% myopic. But we've seen like 3 cases that are high myopia. Means without glasses they can't even recognize their face. But with glasses they're able to see well, 6/6 at a distance, and they can read near tiny things as small as J1 or N5. So myopia is the most prevalent of all the cases we picked among the 20%, among all the students we've seen. Yeah, I think I want to repeat it again. The one that struck me the most is that some students can stay up to 400 level. They have access to healthcare. They have access to state-of-the-art eye clinic. Yet they cannot access it. And each time I try to ask them, what is the reason behind not coming to seek for eye care? They say their parents are yet to send them money. So I'm surprised. So which means all the non-governmental association or all this Sigma, what do you call Sigma? Sigma, is it social club? Social philanthropy. So I'm beckoning on all other social philanthropic organizations to anchor or to copy from the Sigma club. They should be doing health. They should be sponsoring, giving back to the society, especially in the area of health. So this one is an eye opener that people can stay close to the river, and yet they will die of thirsty. So people are living close to the campus, they're staying in hostels, they have eye problem, they have access to free good eye care, yet they can't access the eye clinic. If not because Sigma compelled them. I don't know how you could preach to them to come. And when I come, I saw most of them cannot even see at all, yet they're managing. I asked them, how are they even managing? They said they copy from their fellow students. It's just surprised to understand or to believe that somebody can have this kind of eye defect, yet they cannot access mental care. Either it's Africanism in us, or if it's awareness, is not true. We are doing enough awareness in university health services. We are creating a lot of awareness. So any student who say doesn't know that eye clinics existing and they will have all it takes to pick any eye defect is not acceptable. Thank you.
Hi, I'm Victoria Cyril Aladi. I'm in medicine and surgery 400 level. So for the glasses, there is much difference in the clarity of what I read. It's better now in the sense that I could see things that are closer very well, and my vision is better now. Thank you, Sigma Club. Thank you.
My name is Ide Eniola Mafuro. I'm about 26 students from the Faculty of Basic Medical Sciences. And before I was admitted with the Sigma Club, I was not able to read in the night. I can't even read longer like I used to do before. But now, near wearing the glasses, I can read very perfectly. I've been reading since, and it was very, very good.
My name is Diyangu Inyoluwa. I'm from the Department of Veterinary Medicine, Faculty of Veterinary Medicine. I'm in 20 level currently. Before I got these glasses, my eyes used to get teary and red, giving me headaches, but now I feel better.
My name is Falanjo Enkosaleniola. I'm from the Department of Sociology,
faculty, the social science, and my level is 200 level. I would like to say I'm very grateful for this opportunity. I feel like I can see clearly because before I can't see things from far and I have issue with my eyes. Thank you, Sigma Club.
Well, like they say, government can't do everything, and philanthropy, private sector, individuals, everybody needs to key in to be able to meet, even if it's one person's need that you're meeting, you're still taking that person out of the pool of everything that needs to be done. So it goes a very long way. If everybody is helping one person, everybody's helping a group, I think it really helps. And UHS is open to a lot of philanthropy. We need a lot of things. So if you've taken over 20 people out of the pool of those who require glasses, that's one step. You can imagine doing the same thing for people who need braces or doing for people who need any other thing. So philanthropy goes a long way, and it's something that we welcome in University Health Service. So thank you again, Sigma. I know that I don't know any of the beneficiaries personally, but on their behalf, I'm saying Sigma Club, well done. God bless you. More power to your elbow.
We were able to identify the need for eyeglasses among university students based on our interaction with university students earlier during our outreaches. We've done Sigma Health outreach many times in the past, and during one of the outreaches we were able to do visual acuity tests on which we were able to notice or discover that a lot of students, the large percentage of students who underwent the test had eye challenges, and that was some of the things that brought this process of doing this initiative. Also, from the interactions of Leo Sigma with their colleagues in their faculties, all the residencies and the rest, they were able to also identify the pertinent need for eyeglasses among their classmates and their friends in the hostels. And also, we're also in the digital age and also in the university environment where students read. So there's a lot of screen time. Students spend a lot of time looking at screens, which also has an effect on their eyesight. So these are some of the reasons why Sigma Club brought up this initiative to help students to alleviate the need and also to address the need for good eyesight among university students. Thank you very much.
During the process of the Sigma Lifespring project, what stood out to me were three major things. The first one was the fact that we had surprisingly a lot of applications than we anticipated, and so this led us to go through each and every application to check and prioritize the students of the University of Ibadan that need it more. And secondly was the fact that when we got to University of Health Services, when we told them what we plan to do, they were very happy about our initiative, and they supported us and collaborated with us in any way that they could, which we really appreciated. And the third part was the part of the eye test, whereby we had a very stress-free test. The students came in the morning and they were done as quickly as possible. The test didn't even take. So the glasses they are wearing, how does it feel? I just need, is it better than? It's better, right? Okay, so I would like to appreciate everyone for participating in this exercise. Although we donated the glasses, but then you coming around and having to be a part of this, we also appreciate that, and we hope that this will be able to provide a better view whenever you do your activities, because some of you earlier complained about the fact that you could not read very well and about having to squint your eyes when you're in class and whenever you're working under the sun. So we believe that this will be able to ease your vision from now on. And thank you very much once again. Sigma Lifespring 2025, which is the first edition, we hope that in the future times we'll be able to contribute to society in more avenues just like this. Thank you very much.
Okay, the goal of the Sigma Lifespring is in alignment with the long-standing legacy of service, philanthropy and brotherhood that Sigma Club represents for over 75 years. And the goal is to ensure that indigent students who might face academic stress, due to visual impairments are being helped and alleviated by this program. And considering the fact that this particular initiative was done mid-exam, we believe that students who have visual difficulties such as focusing on a projection for a long period of time and general visual issues will be able to come out with flying colors this time around, considering that the recommended glasses was given to them. Also, this initiative would not have been successful without the support and help of both Sigma and both Chief. So conclusively, I would like to tender my tremendous appreciation to distinguished both Sigma and both Chiefs, whose input was instrumental to the success of this event. Thank you very much. We are truly grateful and we are so proud to be associated with you. Stronger Grace Sigma Club.
Thank you, Sigma Club.
Thank you, Sigma Club, for this opportunity.
Thank you, Sigma Club. Thank you, Sigma Club.
Thank you, Sigma Club.
Thank you, Sigma Club.
Thank you, Sigma Club, for this great opportunity.